Good afternoon. Wherever you may be listening from, I hope this message finds you well. This slideshow will explore the use of MRI and brain imaging, specifically stroke and traumatic brain injuries. We will further explore why MRI is preferred over CT and other medical imaging modalities. Objectives. We will discuss MRI's detailed soft tissue imaging capabilities and how it aids in the understanding of stroke, traumatic brain injuries, and other neurological conditions. We will also address the benefits of brain MRIs versus its contraindications. MRI's detailed imaging. MRI's detailed imaging capabilities assist healthcare professionals in more effective treatment planning as well as identifying the root cause of symptoms. Early MRIs can lead to faster intervention. MRIs are often chosen over other imaging modalities because of the need for soft tissue contrast, detail, and clarity. Diffusion-weighted imaging, also known as DWI and MRI, is a specialized sequence used to assess the diffusion of water molecules within tissues. Diffusion-weighted imaging is particularly useful for detecting acute stroke, differentiating between types of tumors, and identifying pathologies like abscesses, metastasis, and ischemia. Patient preparation for diffusion-weighted images of the brain will include written consent form from the patient before entering the scanner room. We will ask the patient to remove all metal objects. If possible, we'll provide a chaperone for claustrophobic patients. Offering earplugs or headphones or possibly music for extra patient comfort. We will explain the exam procedure to the patient. Also note the height and weight of the patient if the exam includes MRI contrast. Positioning for DWI brain. Patient preparation is key. We need to minimize motion as diffusion-weighted images are highly sensitive to movement. Patient comfort and immobility are crucial. The exam will begin head first supine. We position the head in the caul with cushions and also have cushions placed under the leg for extra comfort. Center the laser beam localizer over the glabella. Localizer. A 3-plane localizer must be taken at the beginning to localize and plan the sequences. Localizers are T1 weighted low resolution scans. For T2 axial images, we're going to plan the axial slices on the sagittal plane and angle the planning block parallel to the genu and splenium of the corpus callosum. Check the planning block in the other two planes and ensure an appropriate angle is provided in the coronal plane for a tilted head. The slices should be sufficient to cover the entire brain from the vertex to the line of the foramen magnum. Contraindications to diffusion-weighted images of the brain will be any electrical, magnetic, or mechanically activated implant, i.e. cardiac pacemaker, insulin pump, neurostimulator, or hearing aids. Also, intracranial aneurysm clips, unless made of titanium. We'll check for pregnancy and weigh the risk versus rewards. Ferromagnetic surgical clips or staples, metallic foreign bodies in the eye, or metal, shrapnel, or bullets. Here are some MRI brain images. We have the brain in the sagittal, coronal, and axial views. A T1 3-plane localizer is used to localize and plan the sequences. Here we have the brain in the sagittal, coronal, and axial view as well in preparation for an MRI scan. The TR for this scan was 30 to 40, TE 100 to 120, and a slice thickness of 5 millimeters. A parametric map of CVR is a test that uses MRI to measure how well cerebral blood flow vessels dilate and constrict in response to a stimulus. During the test, the patient breathes in the stimulus gas like carbon dioxide while lying inside the MRI scanner. The MRI monitors the corresponding hemodynamic changes in the brain. CVR is a key parameter for studying cerebral vascular diseases like stroke, small blood vessel disease, and dementias. It can also be used to assess vascular integrity and healthy aging. Here we have development of the anterior and the posterior lesion on serial DWI images and FLAIR images. The first and two second rows show the diffusion-weighted images on two sides depicting the lesion of development over time from symptom onset. The third and fourth rows show the co-registered fluid attenuated intraversion recovery images corresponding to the DWI slices. This exam was conducted over a 43-day period in different increments. MRI scans provide very clear images without radiation. They're great for seeing soft tissues, show brain activity, and are ideal for diagnosing many brain conditions. This makes MRI a powerful tool in medicine, especially when doctors need detailed information about the brain.